everybody. So I know this is an unusual place. Welcome to my office, I guess. But today I'm going to show you a few things about some things that are kind of hard to do. The first 3 weeks I did not shave under my arm, under either one of my arms, because it was so difficult to figure out how to do it. Well, finally the therapist goes, I'm like, I'm sorry about all the hair under my arms. It's so embarrassing. She says, I got a way to do it. So she showed me. And she said that you might not can do this the first week or two, but when you start being able to stretch your arm out a little bit, very delicately do this, please. Do not strain yourself. And if it starts to hurt, stop. Right then and there. You just stop. So the way she taught me to do it is to sit close to a flat surface around level where you can put your arm on it comfortably, okay? Now when I sit down, I can do it now, but before I had to stand up a little bit and kind of bend over. So just like you would do your wall things, there you go. You stretch your arm out a little bit. And then you can shave under your arm. It's very easy. You got your arm stretched out, shaving under your arm. It may not be perfect the first couple of times, but at least you're starting to get it shaved. Of course, you wouldn't have a shirt on, but that's how you do it. Now with the other arm, it's a little more difficult. I can just start getting there now, but before I couldn't. So with the other arm, just make sure you're steady somewhere, and you can do it with this arm. But that's just all you do. Flat surface, slide. If you need something under your hand to help you slide, that's fine. Slide it out till you can reach your underarm. Razor, shave. You can go up or down this way using the razor that you are most comfortable with. I'm using disposables right now, especially since the first couple of times was a little harrowing, but we got it done. And then you just slide your hand back off and clean yourself up and put yourself in a sling. Also, another thing is deodorant. The first couple of weeks, well actually the first 4 weeks, I used an aerosol spray. I don't particularly care for aerosol sprays, but that's what I used because it's pretty much all you can do. You just stand up, spray under your arm, and do it this way. See? Other side, you just have to do it yourself that way, or you can put regular roll-on deodorant. Now I'm using roll-on again. So you take your, don't break it. Guess I'm ready for new deodorant. You take it, and you can do it just like you did your. Put it on like that, just like you did your razor. And this side is relatively easy. I've been using roll-on on this side the whole time, but just now started using roll-on again for this side. So it's that easy. The bathroom sink's going to be your friend. I also learned that you can go in like your office if you have a rolling chair in your private office, of course. It's a lot easier because you can roll away. You can put your arm up and you can roll away, and it straightens your arm out. Now, like I said, don't do this until you've got permission to straighten that arm out like that. Once you start your pendulums, you'll get where you can, and it'll be really easy. So I'm going to say probably the first week or two, I wouldn't suggest trying to shave under your arms. Nobody's going to care. And then after that, you can try it the way I showed you. Now, one more thing is showering. Oh, there's my bottle. Showering, I had help the first couple of weeks, but you can get the stick brush to shower your back and to hit places that might not be as easy to hit when you first get out of your sling. Some people buy a cheap little sling from like CVS or Walgreens or something to put on in the shower to keep their arm like this. I never did. I had help in the shower the first couple of weeks. I just kept my arm right there by my side the whole time. Now once you are a couple of weeks in and you can move just a little bit. A 2-liter bottle is about the same size as your abductor pillow. So you get in the shower and you can take this 2-liter bottle and lean over and slide it under. You wash under. You can try to do that with the razor, but I wouldn't. It doesn't quite get your arm out far enough, but it gets your arm out far enough to wash under there real good, scrub, and maybe even might put on, roll on deodorant that way too. But that's a really neat trick somebody showed me. This is just about the size of your abductor pillow. So if you lean over and slide it under, it pulls your arm out just enough to wash under there. You can do that with the cheap sling on too, because you can just slide it under the cheap sling like that and wash under. So there's a couple of little tricks there. When I'm shaving, I use a mirror as well. I use a mirror like that. Slide it over, that way I can see what I'm doing. But some people don't need a mirror. I do. I like to see what I'm doing. But anyway, I hope that helps. If it does, like it. Subscribe to the channel or tell your friends about it if they're having surgery, because like I said before, these are things that the doctor's not going to teach you most likely, and unless you ask, most therapists won't. I had to ask my therapist. I'm like, I'm embarrassed for the hair under my arms. What can I do about it? And she's like, oh, well, let me show you a trick, and then showed me right there how to do it. So you have to ask. Ask your therapist, how can I do this? How can I do that? Ask your doctor. Your doctor may or may not know. Or he may say, you know, I really prefer you not do it that way because you're not quite there yet. And like I said before too, with this, sliding your arm out and shaving or putting on deodorant, if it hurts, stop. Don't do it. You're not ready yet. A little discomfort, a little pulling, okay, but when it starts to hurt, you got to stop, because you don't want to injure yourself. You don't want to re-tear. And like I said before too, this is not anything that hasn't been approved by my doctor and my therapist. So ask your doctor about it. Don't take my word for it. It'll help you, but this is not medical advice. I wouldn't count this as medical advice. But anyway, keep watching. I'll have some more videos up soon, hopefully. And, of course, my art videos, too. And hopefully I'll be better before he says I will be. I'm going to be at 2 years before I'm completely better. And don't let that scare you if you're going to have this done or have this done, because I had a more complicated surgery than most people have had. So I'm a little bit different in my recovery period. Like I'm at 7 weeks now, so just now starting to get things where I can do things. I'm still in the sling and I'm still with the pillow, and like I said before, you probably won't be in the pillow that long. I'm just a different case. So hopefully this helped you. I hope so. If you have any other ideas, put them in the comments. I'd like to hear them, because I'd like to make some more videos like this. I'd like to help people. Thanks. Have a great day.